You realize that your burnout is so extreme that you can't stay in your job anymore. You realize that you've become dangerous to your company, dangerous to yourself, dangerous to your career. You've got serious brain fog. You've determined that it's time to go on medical leave because you have no choice. Today I'm going to talk about how to begin medical leave for burnout so that you can recover and get back on your feet. When you're exhausted, you don't have the energy to do research. So I'm just going to give you a list that you can work through. So if you want to grab a pen, the first thing that you want to do is call your company or your benefits provider and ask what your benefits are. You want to learn about both short-term disability leave and long-term disability leave. Once you have that information, you want to see your physician. You make an appointment. It's your doc who's going to put you on leave. They're just going to write you a note. The note is going to say, I put this person on medical leave. That's all it is. The doc sends it to your company, to your HR department. You go home, you turn off your work phone, turn off your work computer, and you crawl into bed and you start to sleep. A lot of people say, well, there's things I want to wrap up before I go on leave. If that's you, I'm going to encourage you to not do that. If you say, well, I have to wrap some stuff up anyway, confine it to a day, maybe 2 days, make a list, decide who's going to do what, send some emails, and then get home. When you're on medical leave, you do have another job. It's going to take you a couple hours a week. You have to keep all the paperwork flowing for the insurance company. An insurance company will send your physician some forms. Your doctor's busy, things can fall through the cracks. It's your job to make sure that the forms get completed and submitted. Stay on top of it, just ask, have you submitted the forms for me? The insurance company or your human resources department will ask you to complete some forms on your own. Once you're on medical leave and you filled out the forms, what's going to happen is nobody's going to talk to you for a while. The insurance company is going to ignore you. Your company isn't allowed to talk to you. Don't expect to hear from anybody at work before 12 weeks are up. A case manager will contact you. You don't have to answer the phone. You don't have to speak to them immediately. If you're overwhelmed, if you're tired, it's okay. Just get back to them before 48 hours have passed. Okay, so how to start medical leave. Find out what the benefits are, talk to your physician, ask them to write a note, disconnect from work, crawl into bed. I'm Dr. Patricia Turner. I'll see you in the next video.